नमस्कार। 2024 की शुरुआत हो चुकी है और इसके साथ ही पद्मश्री सम्मानों की श्रृंखला की भी शुरुआत हो चुकी है। आज हम मिल रहे हैं खास अतिथि से जो मशहूर सर्जन है, प्लास्टिक सर्जन है और दुनिया भर में किसी पहचान की मोहताज नहीं है। डॉक्टर प्रेमा धनराज कर्नाटक से आती हैं और सर्जरी के क्षेत्र में इनकी खासी ख्याति भी है। तो आज इनसे हम बातचीत करेंगे और ये जानेंगे कि कैसे इन्होंने मेडिसिन के क्षेत्र में पद्मश्री सम्मान हासिल किया और समाज के प्रति, राष्ट्र के प्रति इनकी क्या-क्या उपलब्धियां रही और किन संघर्षों से होकर आज ये पद्मश्री सम्मान तक पहुंची है। स्वागत है मैम। सो वेलकम टू आवर चैनल एंड मेनी कांग्रेचुलेशंस कि यू गॉट दिस अवार्ड, दिस पद्मश्री सम्मान. It's really a prestigious सम्मान and award. Can you tell it to our viewers like where you born and brought up and what's your basically how you start this profession? I mean how you come into this plastic surgery and all.
I was born and brought up in Bangalore, and we were a large Christian family. My parents used to sing in the choir, and they were very good singers. It was not profession. My father was in the computers, and my mother was in pharmacy. And but I also had a passion that I want to be a singer like them. I wanted to be a professional singer, not just for like how my parents were just singing. So in the school one day they said that the next day they were going to do the selection for different talents students have. So I decided that I will give my best shot tomorrow and they will select me for singing classes. So as I was walking home, I was thinking I'll go and practice. I came home and then I found that my maid was not there. So I went to light the pumping stove. No gas stove those days, it was only a pumping stove. So I went to light and I found the flames were just flickering. So I thought maybe I'll pour a little kerosene. I was only 8 years at that time. So I poured kerosene and the next minute it blast. So then we were taken to Bangalore hospital. And that hospital actually, that was the only hospital for burns. And those days the treatment was not good. So within a month, my lip was touching my chest.
Oh.
I had no neck at all. And I would cry the whole week because they used to pull my dressing and they made my wounds even worse. So my parents felt very bad that I was crying throughout. So they took me to Vellore. And in Vellore, they took me to the operation theatre 3 times and they could not put in a tube. They have to put the tube so that they can give me anesthesia for surgery. They couldn't do that. So my mother went to the chapel and she prayed. She said, if God gives me a new lease of life, she will make me a doctor in the same hospital, in the same department, and that I will serve the burn victims, burn survivors. So, as if, God was just waiting for my mother to pray. Next day when I was taken to the operation theatre, they could do the surgery. And after a few years, I sat in the same chair where my surgeon sat, in the same department and in the same Christian Medical College and Hospital. So that is how my life began. And my mom was always a great, she influenced me. She gave me the confidence. She gave me the strength to go through with all the problems. And she made me very strong like her,
That's great.
So that is how my life started.
एक ऐसे समय में जब आप स्वयं शिकार होते हैं किसी खास दुर्घटना के, ऐसे में करेज और साहस जुटा पाना ये बहुत ही बड़ी बात होती है, बहुत साहस की बात होती है. डॉक्टर प्रेमा ने बहुत साहस जुटाया. ये स्वयं एक बर्न सर्वाइवर रही हैं, बावजूद इसके इन्होंने प्लास्टिक सर्जरी में नाम कमाया है और बहुत ख्याति भी हासिल की है. मैम, सिंस यू आर ऑल्सो अ बर्न सर्वाइवर, आई मीन what kind of a problem you faced, like since your childhood till your this age? I mean, what kind of anything that you would like to share with our viewers?
Lot of problems because for 1 year my mother never showed me the mirror, and after 1 year, accidentally I looked at the mirror when my maid was cleaning the house, I was shocked to look at myself. I was horrified. I cried as if there is no tomorrow for me. But my mother allowed me to cry. And then she told me, Prema, this is your face. She said, the earlier you accept, the better for you. And after 3 years, she told me, now you have to go to school. I cried a lot because the world, outside world, was not nice to me. So then my mother was very calm and very quiet. She didn't scold me. She said, "Okay." She said, "Don't go to school. Don't study. Don't do anything. Just stay at home. Your brothers and sisters will get married. They'll study well. They'll come up in life, and they'll ask you to cook in the kitchen for them." She said, you want a life like that, or you want to go to school, you want to study, you want to come up in life? She said, which one you want to choose? She gave me the option, and of course, I was crying, and I said, okay, I'm going to school. Because I couldn't imagine myself sitting in the kitchen and cooking for the whole family. So finally, I went. And my mother always sent my brother with me to school, till the bus stand. And he was 1.5 years younger to me. And each time we are going, the people on the road will call us devil, devil, and all that. Oh. So then they'll run, my brother used to squeeze my hand. And he will, but both of us won't look at each other because our eyes is full of tears. And we know if we look at each other and talk, we will cry. So we never spoke to each other, but he'll just hold his hand. I think that is what gave me the courage to face the world, face the society, thinking that because outside my brother was with me. At home, my mother always gave me the confidence. She said, you don't even know who these people are. Today they will say, tomorrow you won't even know where they are. So she said, you should not take it to you just listen and let go. That's it. I think all those little encouraging words made me to be what I am today. So
yeah. हम बात कर रहे हैं उन साहस की कहानियों की जहाँ पे महिला एक ऐसी दुर्घटना में जहाँ स्वयं डॉक्टर प्रेमा जैसी महिलाएं शिकार होती हैं किसी बड़ी दुर्घटना की, पूरी तरह जल जाती हैं, बावजूद इसके पूरी साहस के साथ फिर से उठ खड़ी होती हैं और समाज से मुकाबला करती हैं और अपना करियर बनाती हैं। आज वो बैंगलोर के एक बड़े स्थान में, एक बड़ी जगह पे खुद का एक मेडिकल हॉस्पिटल रन कर रही हैं और बहुत सारे बर्न सर्वाइवर की मदद कर रही हैं जो बुरी तरीके से जल चुकी हैं, उनकी प्लास्टिक सर्जरी में बहुत महत्वपूर्ण भूमिका निभा रही हैं। मैम, द क्वेश्चन इज आल्सो राइज, वी हैव हर्ड लॉट ऑफ स्टोरीज अबाउट द लक्ष्मी cases from Delhi. Have you heard about the Lakshmi burn case?
Which is acid burn.
Yeah, acid burn. She is also acid survivor. So have you met any kind of a person who are like, who come to you and they told some incident, like what happened to them? I mean, these kind of story, how melt you? I mean, how you influenced with all these stories which happen with the girls?
No, there are actually, every person has got a story behind in different ways, in different. In our organization, we counsel them and we see where their weaknesses and we tap their talents and we see how they can come up in life. So. But everybody is important.
You into like acid burn surgery also, right?
We not only do burn surgery, but all reconstructive surgeries we do. We give physiotherapy, occupation therapy, and we counsel them. We have a lawyer to do all the legal aspects, and we give holistic treatment. Mm-hmm. We put the husbands in, the addiction center and make sure that the whole family is together. Children go to school. And finally, the patient is, we make sure that they are financially independent. They don't depend on anybody else. Mm-hmm. So we give them skill training programs so that they can come up in life. So.
पिछले 72 सालों से ये सर्जरी के क्षेत्र में सक्रिय हैं और ऐसी तमाम लड़कियों को, तमाम महिलाओं को एक नई जिंदगी, नई आवाज दे रही हैं ताकि वो समाज के साथ नजर मिला सके और समाज के साथ फिर से साहस के साथ उठ खड़ी हों। मैम, since last 72 years you're into the same field, right? Or
Yes.
maybe the 40 years or maybe 50 or more
Yeah,
than
yeah.
that. What's any dream left? Anything which you want to do for those who are acid survivor or acid victims or burn victims?
Yeah, what actually we are looking at is now that we do surgery, we counsel, we give them holistic treatment. Now, actually, we are looking at our own hospital so that I can do more surgeries. Now we are depending on another hospital. We have an MOU with another hospital. So we're looking to see how we can reach out to more patients who require surgery and more they should all come out of their problems and move into the society as independent individuals and lead a very happy life.
लाइफ। डॉक्टर प्रेमा ने अपनी बेहतरीन सर्जरी के जरिए हजारों जिंदगियों को बदला है और न केवल उनकी जिंदगियों को बदला है बल्कि एक नया मादा भी दिया है कि वो समाज के साथ और लोगों के साथ मिल के खड़े हो सके और अपनी कहानियों को लोगों तक पहुंचा सके। मैम, सिंस वी सी दैट लाइक इन नॉर्थ, सिंस यू आर स्टेइंग इन बैंगलोर एंड इज इट इन साउथ इंडिया, बट इन नॉर्थ इंडिया when we visit or we will go, we didn't find out the proper ample number of surgeries or institutes or hospitals. So what we can do for that, the people who are poor, suppose they belong to a very economically poor section, how they can come for surgery, and is there any facility for them, for the people who are from economically backward classes?
Yeah, but I thought Delhi has Safdarjung, no?
Safdarjung Hospital,
Which
yeah.
is a free hospital, government hospital.
But they don't provide this surgery and all.
Oh, okay.
They just treat for this burn thing.
No, if they can come to Agni Raksha, we'll definitely do it.
Okay.
So,
To your place.
Yeah, but that's.
So I just urge that please mention the hospital name where it is located and how the people can reach. I mean, especially
Agni
the poor
Raksha.
ones. Agni Raksha.
Yeah, it's called Agni Raksha. We named it Agni Raksha. Agni means fire, Raksha means
yeah.
protection. So we would like to reach out to a lot of people, and if they come, we will try and give as much as we can. And if they are from Bangalore, they have the BPL card, so we can. Because earlier, we used to get funds, but now with a lot of rules from the government, I think funds coming from abroad is all not
sufficient funds
sufficient. So that's where I would urge the government to help, because I think Agni Raksha is one of its kind in the world. I'm not even going to say in India. It's in one of the world, because hospitals, they just treat, they do surgery, and that's it.
So can you specify the surgeries? I mean, what kind of surgeries?
All the reconstructive surgeries for burns, which is required, is done. Acute burns we treat, all the dressings. In fact, we even have outreach where we go to remote villages.
You organize camps also?
Yeah, our girls will go there and they will do home dressing. So we have home dressing for patients who can't come to the hospital, because they have to walk and come, they have to get into the bus. They're not rich. So burns is always for very poor people. So we have ambulance and we train burn survivors to be nurses also, because they will have more empathy and sympathy.
Yeah.
They have gone through the pain, so they know how sensitive it is for another patient.
True.
So I think it's been quite effective, because they don't pull like how they pulled for me, because they know what the pain is. So we can have more people going out, more patients can be reached, if only we have the resources. So I would want the government to help us in many ways, in whatever ways they want to. So
they can come to.
They can, yeah.
डॉक्टर प्रेमा जैसी महिलाएं न केवल समाज को एक नई दिशा दे रही हैं, बल्कि उन महिलाओं को में भी साहस भर रही हैं जो महिलाएं बिल्कुल निराश हो चुकी हैं और किसी खास दुर्घटना से जिन्होंने अपना सब साहस खो दिया है उनके लिए भी ये काम कर रही हैं। समाज के लिए, समाज में उत्कृष्ट योगदान के लिए इन्हें पद्मश्री सम्मान से सम्मानित किया गया है। मैं तमाम पूरे राष्ट्र की ओर से और समूची दिल्ली और उत्तर भारत की ओर से इन्हें बहुत बहुत बधाई देती हूँ, कांग्रेचुलेट करती हूँ कि ये इतना बड़ा सम्मान भारत सरकार की ओर से इनको दिया जा रहा है इनके उत्कृष्ट कार्यों के लिए। और मैं चाहूंगी कि ये कुछ शब्द रखें उन महिलाओं के लिए जो इस पीड़ा से गुजर रही हैं। मैम, यू वांट टू गिव सम मैसेज टू दोज हु आर एक्चुअली गोइंग थ्रू दिस पेन ऑफ बर्निंग, और द women who haven't reached the to the hospital yet, they are poor or maybe some reason they didn't and they are still in home. Any kind of a message for those ladies?
Yeah. The ladies who, I would like to say in three steps. The ladies who are, normal at home but depressed because of so many other problems and who are so vulnerable to resort to suicide like this, I will tell them, please think twice before you resort trying to pour kerosene and burn yourself, because one is very painful, two, you already have problem when you're good looking, you will have problems will only multiply when you resort to burning. So I think they should sit and think what they want to do, and they should avoid getting burnt. That is first. Second thing is, those who are burnt, we always teach them the first aid management, how they should put off the fire. If it is electrical, then don't do anything with the water. They have to just, somebody has to go put off the main switch. And but if it is flame burns and if it is hot liquid or if it's acid, then they should pour water. Running tap water is the best. So they can pour it, put off the fire, then they can go to a hospital. And those who are already burnt, there are a lot of new dressing techniques which will help them to reduce the pain, and they can come to any hospital, go to any hospital after they have.
तो हम बातचीत कर रहे हैं एक साहसी महिला से, एक ऐसी विजेता से जो खुद बर्न सर्वाइवर रही हैं, लेकिन उन्होंने अपने साहस से तमाम विपरीत परिस्थितियों को हराया है और आज समाज में नज़ीर बन रही हैं। डॉक्टर प्रेमा से हम लगातार बातचीत कर रहे हैं, कर्नाटक की हैं और सर्जरी के क्षेत्र में इनका बड़ा नाम है। डॉक्टर प्रेमा, आपको इतना बड़ा सम्मान मिला है, पद्मश्री सम्मान, सर्वश्रेष्ठ सम्मानों में से एक। देश के नाम कुछ संदेश देना चाहें तो हमारे दर्शकों को हिंदी में कुछ संदेश दें। कैसा महसूस कर रही हैं आप, कैसा लग रहा है आपको इतना बड़ा सम्मान आपके उत्कृष्ट कार्यों के लिए?
मुझे तो बहुत खुश है कि मुझे ये पद्मश्री अवार्ड मिला है। खाली मेरे लिए नहीं, लेकिन मेरा पेशेंट्स के लिए। अभी तो अग्नि रक्षा पूरा शायद पूरा वर्ल्ड में पता चलता है कि ऐसे एक ऑर्गेनाइजेशन है, ऐसे हम कुछ करते हैं। तो जो लोग को रीच होना, जो लोग हमको हमारा को टच करके, हमारा से बात करके अगर कुछ बेनिफिट पाना है तो अभी आसान होगा उनको, क्योंकि वो लोग को अभी पता चलेगा कि अग्नि रक्षा ऐसा सब कर रहा है। सो in that aspect मैंने बहुत खुश हूँ कि it will reach to
number of people. डॉक्टर प्रेमा अग्नि रक्षा अस्पताल के जरिए समाज की सेवा कर रही हैं और बर्न सर्वाइवर की और बर्न से एक्चुअली जो पीड़ित लोग हैं उनकी मदद भी कर रही हैं। डॉक्टर प्रेमा को हम अनंत शुभकामनाएं देते हैं कि आने वाला वर्ष इनके लिए और भी सुनहरा हो और भी बहुत अनेक सम्मान इनको मिले। बहुत बहुत धन्यवाद डॉक्टर प्रेमा, आपने हमें समय दिया और हमारे दर्शकों तक अपनी बात पहुंचाई। वी विश ऑल द बेस्ट फॉर द नेक्स्ट ब्राइट फ्यूचर एंड होप यू विल सर्व द पीपल हु आर एक्चुअली नीडिंग। थैंक यू सो मच।
थैंक यू सो मच।